Let's talk about the female fetus. In the female fetus, at very first, we have in the 20 weeks we have 7 million primordial germ cells, and during birth it reduced down to 1 to 2 million. In the puberty, in the first menarche, it becomes 3 to 4 lakhs, and up to menopause it becomes 400 to 550 only germinates. So primordial germ cells that are 2n 46 chromosome mitosis to make oogonia of 46 chromosomes. Then the oogonia goes to meiosis 1 and get arrested in the meiosis 1 prophase 1 diplotin stage. After that, this arrest is lifted during puberty. During puberty, what happens? There is LH hormones, LH surge occurs that actually make it release and make two cells, that is primary oocyte of haploid and first polar body. After that, this primary oocyte also goes to arrest in the meiosis 2 metaphase situation. In the metaphase, is lifted during fertilization when the sperm actually touches the ovum, and it makes the secondary oocyte and second polar body. Secondary oocyte and sperm actually got together and do the fertilization. So there are actually two checkpoints, one at puberty and other one is at fertilization. So the puberty, it actually arrested in prophase 1 diplotin stage, and after lifting the arrest it forms the primary oocyte. And the other one is fertilization. It lifts the arrest of metaphase, that in meiosis 2, and forms the secondary oocyte. Okay, let's come to the next part, that is spermatogenesis. Spermatogenesis, obviously primordial germ cells that are diploid that forms the spermatogonia. Spermatogonia, it is also diploid, forms primary spermatocyte that is also diploid. Remember, primary spermatocyte is diploid but primary oocyte is haploid. Okay, now on primary spermatocyte meiosis starts to occur, so obviously secondary spermatocyte becomes haploid. Then they forms four round cells that are spermatids, and after the process of spermiogenesis it forms sperms. Okay, spermiogenesis. After that, sperms leaving and coming into the seminiferous tubules lumen, the process is called spermiation. Let's talk about the period of human embryology. So there are actually three periods: pre-embryonic period, embryonic period, and fetal period. Okay, let's start from the easy part, that is fetal period, that is 9 week to birth. Then comes the embryonic period, it is from the 8th week to 1st week. And let's come to the pre-embryonic period, that is the 1st week, that is from fertilization to the implantation. In the pre-embryonic period, it is most susceptible to teratogens. There is one thing to remember, that is the progesterone secreted from which part. In case of fetal period, the progesterone is secreted by the placenta, but in case of embryonic period, progesterone is secreted by the corpus luteum. talk about the fertilization. Fertilization occurs in the ampulla of fallopian tube. So what happens? The tip of the sperm, that is acrosome, touches the corona radiata part and it releases the hyaluronidase enzyme, that is a lytic enzyme that lyses the corona radiata. Now there is zona pellucida, and inside zona pellucida there is a vitelline layer. We have zona pellucida inside vitelline layer, and then there is oocyte, that when the sperm actually touches the oocyte, the primary oocyte becomes secondary oocyte and forms the second polar body. The second polar body actually trapped in the zona pellucida layer. Now during polyspermy, to prevent polyspermy, there are two things happens. One is cortical reaction, and the second one is depolarization of plasma membrane of the oocyte. It actually prevents the polyspermy. Now zygote is formed. Zygote is the product of fertilization. Inside the zygote there are actually two pronucleuses. These two pronucleuses gone DNA duplication to make 2C to 4C. So we have total 46 plus 46 chromosomes. Then it go simple mitosis. After 30 hours of zygote formation to make two cells. These two cells are smaller cells. Then it forms 4 cell, then 8 cell, then 16 cell, and 8 to 16 cell stage is actually the morula. In the day 4 we have the 8 cell, and then this 8 cells goes compaction and forms the 16 cell stage. This morula has outer layer called trophoectoderm and the inner layer is called inner cell mass. The inner cell mass actually forms the fetus. Now we have a zona pellucida. It actually have two functions. That is, it prevents polyspermy, that is the entry of multiple sperms inside, and the second one is prevent implantation in the fallopian tube. So the zygote actually moves forward, and it moves forward because of three things. One is ciliated cells, the and peristalsis of the fallopian tube. Now, if by any chance ciliated cells mobility decreases, peristalsis decreases, or there is a fallopian tube blockade, it can actually cause the ectopic pregnancy. So, the progesterone hormone contraceptive, if it fails and there is no peristalsis, then ectopic pregnancy can happen. That means pregnancy in the fallopian tube. In the fourth day, the morula actually reaches the uterine cavity. Fourth day means 18th day of the menstrual cycle. Why? Because we have from the first day 14 days ovulation and 28 day is the missed pregnancy. So it is 18 day of the cycle, but for the zygote it is just the fourth day. That means the fetal age. Now comes to the fifth day. Fifth day actually zona pellucida destroyed and it is called zona hatching. That's why from the fifth day the morula is filled with fluid and it is named blastocele cavity. There is fluid inside it and so we call it blastocyst. We have two things right now, one is trophoblast and the other one is inner cell mass. In the sixth day, the implantation occurs. Sixth day means 14 plus 6 is equal to 20th day of the menstrual cycle. So if the question asks the time of implantation, it is 6 to 10 day, that is actually 20 to 21st day of menstrual cycle. So there are phases of implantation. There are four phases. One is apposition by selectin protein, then adhesion, that is by integrin protein, third is penetration, and fourth is invasion by metalloproteinase enzymes. Now there is a Nita Books layer that actually prevent penetration of the blastocyst, because after that there is endometrium ends and myometrium begins. The site of implantation is the upper posterior wall of uterus close to fundus, not the fundus. It is actually interstitial implantation deep inside endometrium. Implantation is caused by the trophoectoderm. Now there are two signs, that is, one is Pisch-Kachek sign and the other one is Hartmann sign. Pisch-Kachek sign is said that asymmetrical growth of uterus happens in the early pregnancy. That is the formation of true gestational sac. It is always eccentric. The next is Hartmann sign, or placental sign. It is bleeding in implantation. Bleeding occurs if the implantation happens in some females. On USG, we see intradecidual sign. That is the first sign of pregnancy. Now let's make a picture that we can see there is a bulge in the site where the implantation occurs and it eccentrically grows. That's the true gestational sac. So if we make a picture now, after the implantation, endometrium is called a decidua, and we have three decidua types. The decidua that is behind the zygote is called decidua basalis. It forms the placenta. The decidua that is in between the zygote and the uterine cavity is called decidua capsularis, and the rest of the decidua is called decidua parietalis. Over the time, the uterine cavity gets filled by the fetus and the decidua capsularis come close to the decidua parietalis. So this is the fetus. When the uterine cavity gets obliterated, that is 14 to 16 weeks, in some books it is written as 12 to 16 weeks, that means the decidua capsularis and decidua parietalis actually touches each other. That means they cannot be separated. So in twin pregnancy, that means dizygotic pregnancies, that are two zygotes from two ova and two sperms, the ovaries can come in same cycle or in different cycle. The same cycle is called superfecundation, SC, and if it comes in different cycle, it is called superfetation. superfetation is not common in humans, but if there is a question that when after superfetation cannot happen in a human pregnant lady, the answer will be up until the uterine cavity is not obliterated. That means decidua capsularis and decidua parietalis are not touched each other. In USG, what we see the second sign, that is double decidual sac sign. The inner one is decidua capsularis and the outer one is decidua parietalis. It is nothing but two concentric balls. On the 8th day, now the blastocyst trophoblast divides into cytotrophoblast and syncytiotrophoblast. Syncytiotrophoblast actually synthesizes the hormones of placenta. And cytotrophoblast forms two things, that is villus trophoblast and extravillus trophoblast. The villus trophoblast is near the decidua bacillis and forms the chorion frondosum, that is the fetal sign of placenta. So fetal sign of placenta is chorion frondosum, whereas the maternal sign is by decidua bacillis. Whereas the extravillus trophoblast actually prevents pregnancy-induced hypertension. So it is the rough side. The rough side is cytotrophoblast, that is also the chorion frondosum, the fetal sign of placenta, and the opposite side is smooth, that is chorion leaf, that forms the chorion. Let's talk about the inner cell mass. The inner cell mass forms the embryonic disc. This is the embryonic disc, simple. Over it we have the first ectoderm. From the ectoderm, amnion is secreted, and under it we have the second layer, that is endoderm, whereas the yolk sac is created. In between them, the third layer becomes the mesoderm. On USG, now we can see a double bleb sign. Embryonic disc now forms two folds. One is cranial fold and the other one is caudal fold. So let's revise. Chorion is created by cytotrophoblast, whereas amnion is created from the ectoderm. On day number 21 after the fertilization, we see the first heart activity. It is only visible in the USG, not heard via stethoscope. Let's understand the concept of duration of pregnancy versus fertilization or fetal age. The duration of pregnancy, if we take this timeline, the first day of last menopausal period, on the 14th day we assume ovulation happens, and in the same day fertilization as well happens, and in the 28th day the woman missed her periods. So the LMP, from the LMP we count the duration of pregnancy. Now if a lady does her urine pregnancy test on the 28th day on missed period, then we'll say her that her duration of pregnancy is actually 4 weeks, because the duration of pregnancy is actually calculated from the last menopausal period. Let's use this concept in the gestational sac. The gestational sac is formed on the 29th day, that is 4 weeks plus 1 day of pregnancy. That is also 14 plus 1 day of after fertilization, that is also the fetal age. We can see the intradecidual sac sign, that is the first sign of pregnancy in USG. So if it is a timeline, it is the first day, that is last menopausal period. On the 14th day, ovulation and fertilization happens. On 28th day missed period. On the 29th day, we can see the gestational sac. That means we have the 14 plus 1 day after fertilization and 4 weeks plus 1 day of pregnancy, that is 29th day. Now on USG, we can see the first sign, that is intradecidual sac sign. What is the gestational sac? It is nothing but the embedded zygote. It is not actually zygote in the state, it is actually blastocyst, whatever. It is the gestational sac we can see. On USG, the first sign is intradecidual sac sign, that is the first structure is gestational sac. Next is double decidual sac sign formed by the decidua capsularis and decidua parietalis, never decidua basilis. Okay. Next is double bleb sign by the cavities of amnion and yolk sac. What does the amnion yolk sac does? Okay. So chorion forms the chorion leaf of cytotrophoblast. It is the outermost fetal layer, whereas amnion is the innermost fetal layer. There is no nerve, no vessels in the amnion, and yolk sac is the first site of fetal hematopoiesis and source of alpha fetoprotein. The biochemical marker will be beta HCG level more than 2000 international unit per liter. So if a question comes that in a woman of beta HCG 2K plus but no gestational sac is seen in TVS, then it means that implantation happened but not in uterus. That means that it is an case of ectopic pregnancy. Okay. For TVS, the amount of beta HCG is 2000 international unit per liter, and for TAS, it is 6500 international unit per liter. This is called dyschimetry zone or critical value of beta HCG. Now, in a woman, if we see that urine pregnancy test is positive, but no gestational sac in TVS is seen, and also beta HCG level is less than 2000 international unit per liter, that means that tell to wait for 2 to 7 days. Okay, because beta HCG level doubles in every 48 hours. That means normal pregnancy, intrauterine pregnancy. And beta HCG level increases but not doubles in 48 hours, suggests ectopic pregnancy. Also, let's consider another case, that is mean sac diameter MSD is 10 mm plus, but no yolk sac is seen. Then it is a pseudo gestational sac of ectopic pregnancy. Let's talk about two types of gestational sacs. One is true and other one is pseudo gestational sac. The true gestational sac is found in intrauterine pregnancy, whereas pseudo is found in ectopic pregnancy. In true one, we can see that decidua parietalis, decidua capsularis, decidua basilis is present, whereas ectopic there won't be present. The true one will be eccentric, whereas pseudo one is centrally located. Double decidual sac sign can be seen in true gestational case. The yolk sac can be seen, double bleb sign can be seen, and none of them can be seen in the pseudo gestational sac. Next is another question, that is mean sac diameter is 25 mm plus and yolk sac is present but not getting any crown to rump length or any fetal heart activity. Okay, then it is a case of blighted ovum, that is an embryonic pregnancy. If we see another case, there is a gestational sac, there is a yolk sac, there is also a crown to rump length that is 7 mm, but no cardiac activity, then it is a missed abortion. Now, if a woman comes with a gestational sac of 20 millimeter mean sac diameter, yolk sac is present, but no crowned rump length or no cardiac activity, then what we'll do? We'll wait for 25 millimeter of MSD.